It's no secret, Dallas is a great place to live. In the past 7 years, more Americans migrated to Dallas than to any other city, making Dallas one of the fastest growing cities in the U.S. And with the Dallas-Fort Worth metro area gaining more than 90,000 jobs in the past year, we rank third in both the number of jobs added and the annual rate of job growth. We have a lot going for us. But underneath all this economic growth is a serious problem. A whopping 30% of our children live in poverty, leaving Dallas tied with Phoenix for the third worst childhood poverty rate among major U.S. cities. To visualize this number, the largest covered sports stadium by capacity is our very own AT&T Stadium. The number of Dallas County children living in poverty would fill the AT&T Stadium 2.5 times. What's more, with 13% of local children lacking insurance coverage, Dallas has almost double the national average of uninsured children.
I'm Shauna Valentine. I'm currently in the upscale resale shop. I typically am wearing a white coat. As a cardiologist in Dallas, I've been practicing medicine for almost 20 years. I'm happy to be here because as a part of Lifesavers, the upscale resale shop is used to fuel the many projects that we're passionate about. I've realized that there are many people that don't come to the doctor's office, and especially children in need. I mean, how much that feel when parents know that they don't have access to the basic things that we take for granted. Medicine, doctors, and relationship with doctors. I cannot imagine the agony of watching your child get sicker and sicker, and at what point do they realize the only option they could exercise is waiting in a long line in the emergency department. I cannot even imagine that. Therein lies a deep need for something like the Doctor Spot.
The Doctor Spot serves children 0 to 18. These are children who are sick, who may need vaccinations. These are also children who are well and just want a checkup, or who may have other problems such as being overweight or obese, and they need just a little bit of education. One of the things that's really unique about what we do is the fact that we're mobile. We go in their communities. We go to their schools. We go to the apartments complexes that they live in. Oftentimes these children and these parents don't have transportation, and they don't have a way to get to the doctor.
This is my daughter. She actually needed her shots for school today. But I think it's a really good benefit because it saves time, and it also helps people that can't travel or don't have a car. They can just walk right up and get the shots they need for their children.
She has an ear infection, and that's because she has this cold.
Yeah.
Which happens a lot. When they get colds, they can get... I grew up in poverty, like many of these patients that we see. I did not have access to medical care. My mom did not have insurance for us. And so doing something like the Doctor Spot is real special to me because, you know, I didn't have access to medical care. Oh, I absolutely love what I do. This is my passion. Give her this and you this to read. Okay, it's about Jesus and God.
Yeah.
You're welcome.
What makes Lifesavers different is that they truly put a heartbeat into the mission of assisting women and children in crisis. Our volunteers, our staff, our foundation, the people that support us, we truly are the hands and feet of Jesus as we help those in need.
What makes our area such a great place to live isn't just the economic growth and opportunities we provide. It's the quality of people. People like you, who understand that caring for those who are less fortunate than ourselves isn't just an investment in our city's future health. More importantly, it's the right thing to do. Thank you for your most generous support of the Doctor Spot.